welcome back to Survivor's Guide to Life. My name is Jessica Lang, and this channel is all things trauma, the brain, and healing. So if that's your jam, click that subscribe button down below so you can be notified every time I upload a new video. Also, jump all over to Instagram. Follow me over on Instagram where I give more tips, tricks, motivation, skills, all things related to mental health and mental wellness. So go ahead, follow me on Instagram. You won't regret it. So today's topic I have been wanting to do for a minute, and I really enjoy reading the DSM to you guys and sharing my wisdom as a therapist, but also giving you some insight about what us mental health professionals use when clients come in and they tell us what they're struggling with, and we work with insurances, those of us who do, and we have to give you a mental health disorder diagnosis. But also it's very helpful and very useful to kind of know what's going on, to have a name for something so you can kind of figure out what to do about it, not so it's like part of your identity. So one of the ones I want to talk about today is it's actually on the first page of the trauma and stress related disorder category of things, but it is something that is only in children, and it's called reactive attachment disorder. Now, reactive attachment disorder is something I feel like doesn't get talked about nearly enough, if at all. And this is purely and obviously an attachment related disorder that if you are a foster parent or you have adopted children, even if you adopted a baby, but especially if you've adopted toddlers or older children, you might see a child who has reactive attachment. And basically, before I read it, I'm just going to give like a little mini summary. It's like it's disorganized or insecure attachment towards caregivers based off of like a history of mistrust, a history of abuse, where adults are seen as untrustworthy, they're scary, they're unpredictable, they're chaotic. So it's a whole host of symptoms that are based off of, just like PTSD, survival adaptations, because their little stress systems have been stressed to the max. They've never returned to baseline. They don't have and they didn't have a primary caregiver to help them feel safe. They had to learn on their own, and they use these survival adaptations to cope with life, and it causes a lot of distress for them and a lot of distress for the adults. So I just wanted to tell you what it was, give you some little tips and tricks to help you if you're a parent who's struggling with a child who has reactive attachment disorder, and I hope that this video helps you. So reactive attachment disorder, diagnosed A consistent pattern of inhibited, emotionally withdrawn behavior toward adult caregivers, manifested by both of the following. 1. The child rarely or minimally seeks comfort when distressed. 2. The child rarely or minimally responds to comfort when distressed. This one is really hard for parents. It's funny, I've only really seen reactive attachment disorder in children who've been abused. I've never seen it, or children who have, been adopted, or in foster care. Again, usually the adoptions are foster. Yeah, sorry. And usually like these adoptions are these foster care placements were as a result of like parental drug abuse. B, a persistent social and emotional disturbance characterized by at least two of the following. 1. Minimal social and emotional responsiveness to others. 2. Limited positive affect. 3. Episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interaction with adult caregivers. C. The child has experienced a pattern of extremes of insufficient care as evidenced by at least one of the following. 1. Social neglect or deprivation in the form of persistent lack of having basic emotional needs for comfort, stimulation, and affection met by caregiving adults. 2. Repeated changes of primary caregivers that limit opportunities to form stable attachments, frequent changes in foster care. 3. Rearing in unusual settings that severely limit opportunities to form selective attachment, institutions with high child-to-caregiver ratios. D. The care in criterion C is presumed to be responsible for the disturbed behavior in criterion A. E. The criteria are not met for autism spectrum disorder. And F, the disturbance is evident before age 5. G, the child has a developmental age of at least 9 months. So that's why I wanted to read that, because again, if you are thinking about becoming a foster parent, you are a foster parent, or you're adopting an older child, really, as much as possible, getting a history of that child, what the parents like, and even if you don't have all the details, but you have some details here and there, try to imagine being that small child, having and being in an environment where your emotional needs aren't taken care of. So that means like, and I'm thinking so a baby who's crying and a parent who doesn't go to soothe them, a baby who's crying and they're hungry and they're being inconsistently fed. So maybe mom's on drugs, she's gone for a couple of days here and there, so the baby goes for a couple of days without eating, right? What does that do? How does that make the child feel like they're loved or cared for, or that their needs matter? I mean, it's not like on a cognitive level or a conscious level in the way that we might think of it as adults, but again, brain, development happens in a repeated fashion, right? You need consistent, repetitive patterns of interactions. And so if you have a consistent pattern of negative interactions that encourage these survival adaptations, and that's going to be what's predominant for these children, as opposed to like, and you, the new person who's, coming in loving them, they've never experienced that. They experience that as a threat. So they're going to, they may react aggressively. And one thing that the book doesn't talk about, one thing the DSM doesn't mention is exactly what some of these behaviors look like. And for the children I've worked with who have reactive attachment disorder, in the DSM-4, we used to divide it by 2. Is editor Jessica jumping in because I realized I made a big mistake when I was recording this video. So what happened in the previous edition of the DSM-4 is that they used to have a reactive attachment disorder be one diagnosis with just 2 different parts. So you would have the disinhibited part, and you would have one that was more inhibited. They were considered one disorder with just 2 different behaviors. But what the DSM-5 did was they actually completely separated the 2, so that you have reactive attachment disorder, which used to be inhibited, the inhibited type, as one type of disorder, and then you now have disinhibited type, and it's called the disinhibited engagement disorder, disinhibited social engagement disorder, which is used to be a branch of reactive attachment, but now it's its own separate DSM disorder. So I'm going to pop in right now for you to read what disinhibited social engagement disorder is. What I didn't particularly talk about in this video because I just completely forgot about it, and I don't know, was in a rush doing these videos. So here it is, disinhibited engagement social disorder. It's connected to and related to reactive attachment disorder, but it's considered a separate disorder now in the DSM-5. Inhibited or disinhibited. So the inhibited children were like more anxious. They were also tended to be like really aggressive. They would not I'm thinking specifically of a child that I knew who, like, she would hide and you would call her name, look for her all over the place, and she would never come out. Like she didn't think of that as something that could be potentially dangerous or potentially scary. Running out in the street, whatever. Like they just, they were very weary, very leery of adults. They didn't go to adults if there was a problem. They were often very parentified in their behavior. That's what you get with like some of that more inhibited type. With disinhibited, they would go to anybody. So anybody who showed them the slightest attention or affection, they would cling on to them. So these are children who are going to be more susceptible to being kidnapped or abused later in life. And I mention that because, again, the behaviors you see are pretty extreme and pretty severe. And so if you, as nice as it is to have a child who comes to you and is, oh, I love you, and it reinforces like your need, all of our needs that we have, to be loved and to be nurtured. So to have a child who's like, very clingy, or I love you, or doesn't want to be away from you, which you might get when you are fostering or adopting or what have you, and this child is like really, really compliant, oh, they're amazing, they are also the type that, you know, they've realized that that's how they're going to get their needs met. And if they have any sexual abuse history in their past, a perpetrator will spot this, and they'll be able to take advantage of it through grooming behaviors. And then what you get is a child who's more susceptible to being sexually abused later on, and then having the self-blame attached with, because children need love, they need attention, they need affection, and with their need of, you know, it's like they engage in like these seductive behaviors. I put that in quotes because that's the way it's been described. It's very enticing, and so they end up like internalizing a lot of blame because they feel like they brought upon the abuse by being loving and affectionate and receptive to an adult who was like giving them attention. But it's a fear based, right? Like it's fear of being left alone, or fear that their needs are not going to be met, fear that they're going to be hungry. You know what I mean? So like it's coming from a fear-based perspective, a fear-based survival adaptation, as opposed to like one where it's like one of love and like trust and a sense of safety. Like they don't actually trust themselves or trust adults. They're just going off of like what's worked in the past, if that makes sense. Oh, so if you have a child in your home that you think might have reactive attachment, or they've been given the diagnosis of reactive attachment disorder, please find, if they're really young, find a therapist who works specifically with the 0 to 5 population, 0 to 5 mental health population. They're going to do a lot of work with you and the child to build your relational dynamic, and to build like a healthy pattern of interpersonal relationships, and give you, the parent, skills, also give the child some skills, learning how to like read the child's cues and their needs, setting boundaries appropriately, things like that. I mean, you're going to do that anyway, whether but specifically if the child's under 5, I would say find a therapist who works specifically with 0 to 5. But if your child is a little bit older, still finding a therapist who will work with you and the child together. You've got to be invested in doing the work also. It's not just the child. You're coming in as a unit. So that means like some of your own childhood stuff is probably going to be uncovered. You're going to really learn about yourself and your own needs. And so this is the case that I always harp on therapy, but specifically with a child who might have or does have a reactive attachment disorder diagnosis, they're a lot of work. They really need you to be consistent, loving, nurturing, safe, predictable. The typical kind of parenting, child rearing practices that maybe you've used on your other children, or you've used with or maybe that have been handed down to you, may not be as effective. And so it's really important that you that in working with a therapist, like, you also do your own work, because it's very exhausting, it's very hard, it's very frustrating, but these kids really do need you, and they need you to be like top of your game. So working with a therapist, definitely, really trying to figure out, like, get that history down pat. What's going on for them? What are their antecedents? What are their triggers? So like trying to learn about the child, learn from them, from their behavior. Sit back and watch them. Don't say anything. Go with an open mind. See how they play with other children. See how they interact with other adults. Make mental notes. If you feel any type of discomfort or something, you're like, this is a little strange or a little bit off. That's why I say working with a therapist, because you can bring it up to the therapist. I noticed this, what do you think this means? Really talking about it. Have a good support system, of your own friends or other parents, where you can kind of talk about these things, because these children, they need all your love, all your patience, but they can be very hard to live with and to love. Because they may not always express it in a healthy way, because they don't know how. So they're needing you to teach them. So I just wanted to briefly talk about reactive attachment disorder. It's not something that I think is ever really discussed in the media, but that's where it is. Now it's your turn. Comment down below. Let me know, what do you think about reactive attachment disorder? Do you have a child who lives with you who you think has reactive attachment, or has a reactive attachment disorder diagnosis? Remember, it's a lot of the treatment, it's in the trauma symptom, this trauma stress related category of things. So The behavior, the treatment is going to be a lot like how you would treat a PTSD, except now you're talking about young children, and they really do need you, the adults in their lives, to be their safe, trusting, nurturing, protective person. You're going to have to do all of that work that their bio parents unfortunately didn't do. So it can be done. Healing is possible. Please, if you have a child who has reactive attachment, get them a therapist, work with that therapist, find somebody who's skilled. It's a game changer, I promise. So that's all I have for you guys today. I hope you liked this video, and I'll catch you in the next one.